Assalamu alaikum. I am Dr. Mahbubur Rahman Polash, Assistant Professor, Department of Pharmacology at Bashundhara Ad-din Medical College. Welcome in our today's session. Today we will discuss about drug. The word drugs come from drogu, a French word which means a dry herb. The World Health Organization gives a definition of the drug. A drug is any substances or product that is used or intended to be used to modify or explore the physiological system or pathological state for the benefit of the recipient. Modify physiological system, it means alter the normal physiology, like oral contraceptive pill prevents ovulation and thus prevents pregnancy. Pathological state, antimicrobial agents cure infection. Now come to the benefits or use or purpose of drug. Number one, for diagnosis of disease. Drugs are used for diagnosis of different diseases like barium salt for diagnosis of GIT lesions by barium meal X-ray. Radioactive iodine is used for diagnosis of hyperthyroidism. Now come for prevention of disease. Vaccine prevent communicable disease. For example, tetanus toxoid is used for prevention of tetanus, and contraceptives prevent unwanted pregnancy. Number three, for the control of disease. Sometimes all diseases cannot be cured. Some diseases need to be controlled, like hypertension and diabetes mellitus. Antihypertensive drugs for the control of hypertension, and insulin is used for the control of diabetes mellitus. For treatment of disease, antibiotics are used for the treatment of infections and analgesics are used for pain. Now come to the difference between drug and medicine. Drug is the active ingredient of medicine, and medicine is the combination of drug and excipient. Drug is used to diagnose, prevent, control or treat a disease. On the other hand, medicine is used to treat a disease only. Drug, it may not have suitable dosage formulation, but medicine, it has a suitable dosage formulation. All drugs are not medicine, but all medicines are drug. Drug has only generic name, but in case of medicine, it has both generic and trade name. Excipient. Additional chemical substances that are used in drug production having no drug property is called excipient. Now come to the component of excipient. Diluents examples are dextrose, lactose, starch and sucrose. As binder, methyl cellulose is used. Starch and vegam used as disintegrating agent. Caramel, brilliant blue used as coloring agent. Orange flavor, peppermint flavor, banana flavor and mango flavor is used as a flavoring agent. As lubricant, stearic acid is used, and sweetening agent, saccharin, lactose and mannitol used as a sweeteners. Drug nomenclature. A drug generally has three categories of name. Number one, a chemical name. Number two, generic name, and number three, trade name or brand name. Chemical name. This name is used by chemists and denotes the chemical structures of drug. It is long and difficult to remember, not suitable for routine use. For example, chemical name of aspirin is acetyl salicylic acid, and chemical name of paracetamol is N-acetyl aminophenol or acetaminophen. Number two, generic name or non-proprietary name or official name. Describe some chemical and pharmacological criteria of drug, short and easy to remember. Generic name of a drug is chosen by official agencies. Official agencies are International Non-Proprietary Name INN, British Approved Name BAN, and United States Approved Name USAN. Generic name is ideal for prescription writing and is used by medical professionals. For example, paracetamol and aspirin. Number three, proprietary name, trade name or brand name. This name is given by drug manufacturer company, so one drug may have several trade names. For example, Napa is the trade name of the paracetamol and Dispirin is the trade name of aspirin. Paracetamol is the generic name, Napa is the trade name, and N-acetyl-aminophenol or acetaminophen is the chemical name. Another example, aspirin is a generic name, Dispirin is the trade name, and acetyl salicylic acid is the chemical name of a drug. Now come to the sources of drug information. Number one, pharmacopoeia. There are several pharmacopoeia like British pharmacopoeia, United States pharmacopoeia, European pharmacopoeia, Japanese pharmacopoeia, and Indian pharmacopoeia. Number two, formulary, Bangladesh National Formulary and British National Formulary. Textbook, Basics and Clinical Pharmacology by Bartram G. Kerjang and Clinical Pharmacology by Bennett and Brown. Number four, medical journals, British Medical Journal, Biochemical Pharmacology, Molecular Pharmacology, and Japanese Journal of Pharmacology. And number five, pharmaceuticals company. So these are the sources of drug information. This is all about today. Thank you all and welcome for our next session.